Hello friends, I am Dr. Himanshu Tyagi, an orthopedic surgeon in Delhi. Today, I'll be talking to you about a very common sports-related knee injury called as anterior cruciate ligament injury. ACL injuries are very common among athletes, but they can also happen in daily life. Let's understand what it is, how it happens, how to recognize it, and how we treat it. Firstly, let's understand what is the ACL. ACL stands for anterior cruciate ligament. It's one of the main ligaments inside the knee that connects the thigh bone or femur to the shin bone called as tibia. Its job is to keep the knee stable, especially during twisting, turning, or sudden stops. When this ligament tears, it causes instability and pain in the knee. So, what causes ACL injuries? ACL injuries mostly happen during sudden changes in direction, like in football or basketball. Sometimes it can happen during twisting of the knee, during sports or running. It can happen during jumping and landing awkwardly also. Rarely, direct impact to the knee, like a fall or road accident, can also cause it. It is most common in young active people, especially athletes. Now let's talk about symptoms of ACL injury. If you have an ACL tear, you may feel a loud popping sound at the time of injury. Severe pain and swelling within a few hours can happen. You will have difficulty in putting weight on the knee. Also, feeling of the knee giving way or being unstable will happen. And of course, you will have difficulty in walking, running, or using stairs. Sometimes swelling may go down in a few days, but the knee remains unstable. That's a red flag. Next important question is, how is it diagnosed? To diagnose, your orthopedic doctor will ask you about how the injury happened. He will do a clinical examination to check knee movement and stability. Also, he will perform special clinical tests like the Lachman test or pivot shift test to confirm his diagnosis. Finally, he will order an MRI scan to confirm the diagnosis. MRI is the best tool to clearly see the torn ligament along with any damage to the meniscus or cartilage. So this brings us to now the treatment of ACL injury. The treatment depends on age of the patient, his activity level, the severity of his tear, and finally whether the knee is unstable or not. There are two main approaches. First is non-surgical treatment applicable in conditions like partial ACL tears or older or low activity patients or patients with stable knees. In such cases, treatment includes rest, arm, icing, followed by bracing of the knee. When the pain and swelling, we can start the patient on physiotherapy to strengthen muscles. However, we advise to avoid high impact activities like jumping and dancing to the patient. Second treatment option is the surgical treatment. This is known as ACL reconstruction surgery. This is recommended for complete tears, especially in young and active patients with unstable knees. Surgery is done arthroscopically, which is a keyhole surgery using a small camera and tools. The torn ligament is replaced with a graft, usually taken from the patient's own hamstring or patellar tendon. Post-surgery, the physiotherapy is very important for regaining strength of the knee, restoring full movement, and preventing future injury. Recovery takes 4 to 6 months depending on rehab progress. So remember that ACL is a major ligament that stabilizes the knee joint. It is commonly injured during sports or twisting movements. Symptoms of complete tear include pain, swelling, and knee instability. Diagnosis is confirmed with MRI. Treatment can be with physiotherapy or surgery depending on the case. Early diagnosis and proper treatment help you get back to sports and normal life. If you or someone you know has knee pain or instability, consult an orthopedic specialist without delay. Thank you for watching.